You might remember a few weeks ago I went to the supermarket and I bought one of these cheap, or relatively cheap, £5 vitamin D tests. And this was the result that I got from that. So this was the test here. It's one of these tests here. This is the control. That was the test result. You put your sample in there and you put your buffer in there. Now the result I actually got, as best as I could tell from this test line here, was I was in this range here, the insufficient range, which is 10 to 30 nanograms per mil, or 25 to 70 nanomoles per litre. So according to this test, I was in the insufficient range, less than 75 nanomoles a litre. Now, actually, I was fortunate enough to go to my GP, and she kindly actually did my test properly just a couple of days after this. In fact, a day after that, I think. And my actual level was 102. So you can see that's about, what, 41 nanomoles per litre. It came back at 102, which puts it in the middle of the NHS range, which is between 50 and 150. So that was the result from the GP, from the official lab. So this test will be accurate. So that meant when this test here, my actual number was 102. This test here said I was less than 75. It means this test was wrong. So this test is inaccurate. Unless, of course, the official NHS test is inaccurate, which I think is phenomenally unlikely. So this test may have shown if I had excess when you would have got no line at all. But it didn't. It showed I was insufficient when in actual fact I should have been in this range here, sufficient. So not very satisfactory really, but it's good. So my actual range there is 102 nanomoles a litre, which is about 40 nanograms per mil. It really is a pity we've got these two different types of units, but there we have it. So the optimum range, of course, is a bit higher than that, so I'm going to try and bump my vitamin D up a bit higher than that by taking a slightly higher dose. But I just thought I'd bring you that result as a matter of passing interest.